The case study we analyzed was common source outbreak of waterborne shigellosis at a public school. In 1972, a public school in Iowa was affected by a gastrointestinal illness. 72% of the children and 61% of the faculty and staff were affected. The contaminant agent was called Shigella soni. A few weeks after that, a doctor in Iowa contacted the state health department to let them know that a woman who lived across the street from the public school was also suffering from shigellosis. Similar illnesses were reported by athletic teams who had visited the school during this time period. This picture shows the layout of the area surrounding the public school in our case. This shows that the water supply supplying the school, the apartment, and the gym, where people became ill, all came from the same wells located on the school grounds. Environmental studies, microbiological testing, as well as the construction of the wells, the water flow, and the cross-connection tests were all performed on the wells. After the outbreak, the water supply of the school was connected to the municipal supply to avoid further illness. After the new water supply was implemented, they investigated the two wells, which were previously used. They discovered that the wells were not watertight and allowed groundwater to leak into the wells. All attempts to show cross-contamination failed except for the showers located in the utility room in the basement, which were just installed before the outbreak. The showers drained into the gravel and not the sewer system, so when dye was flushed down the drain, it was discovered in the wells within hours. The water within the school did test positive for Shigella soni.
Waterborne shigellosis. Well, what exactly is it? It's an intestinal tract infection caused by the Shigella organism, and the Shigella organism is a bacteria that passes from one infected person to another. For example, passing from stool to stool, or fingers of one to the mouth of another person. The source of infection for shigellosis is the waste of the infected individual or another person who is carrying the disease, known as the carrier. Shigellosis can be spread by ingesting food, water that is contaminated by any fecal matter, inadequate hand washing, and toddlers who are not fully toilet trained. In addition, flies are a vehicle and a vector of shigellosis, and fomites, which are non-living objects such as doorknobs, clothing, and phones, can also cause the spread of the shigellosis disease. Now you are probably wondering, what are the associated signs and symptoms of the shigellosis disease? From the time of exposure to the first symptom that has appeared is known as the incubation period, which is known to be between 1 and 4 days. Things such as fever, irritability, drowsiness, vomiting, abdominal cramps, diarrhea, and anorexia are all possible symptoms that will appear in the infected individual with the shigellosis disease. Now down the road, within 3 days, pus and mucus will appear in the stool, and an increased number of stools, ranging up to about 20 or more a day, will begin.
The Shigella organism within our case study was Shigella soni. Once the bacteria has been ingested, it works its way down to the stomach, small intestine, and stays in the large intestine where it causes the damage. It only takes one organism to be infected, as the bacteria is very infectious. Once the Shigella organism has reached the large intestine, it begins to immediately affect the epithelial cells within the walls of the large intestine. The epithelial cells work to absorb water, but as they are affected, they can no longer do so. The Shigella organism also goes on to affect the ribosomes within the large intestine, causing protein synthesis not to happen. These both cause problems within the large intestine, leading to malabsorption of water and leading to blood and mucus found within the stool. Many people would assume that washing our clothing also disinfects it, but unless you are taking specific precautions to disinfect your loads, odds are the bacteria is still lingering. The key to killing this bacteria, especially when sick, is putting clothing in the dryer on the highest heat setting for at least half an hour. This will ensure that all bacteria is gone. Allowing your water to maintain a rolling boil for over a minute will ensure that all bacteria is eliminated from your water. Then you are able to cool the water and set in the fridge, and you have perfectly safe drinking water. An important tip to remember is to always close the toilet lid before flushing. If you don't close the lid before flushing, the bacteria within the toilet will be spread across the bathroom, and this increases the chances of secondary contraction from other people using the bathroom. In 1846, hand washing was invented by Ignaz Semmelweis and is still currently the best method to prevent disease. Gloves are also recommended for people dealing with sick individuals and in the healthcare setting. These hand washing instructions are found on the Public Health of Ontario. There are three main treatment options for shigellosis. The first option is to let the bacteria run its course. It typically resolves itself within 5 to 7 days. The second option is over-the-counter medications, such as Pepto-Bismol, which can help relieve some of the symptoms you are experiencing. And third is antibiotics. Antibiotics are only given to severe cases, and some shigellosis strains are not affected by antibiotics, so it depends which strand you have.